nothing is 100%, but this is probably 75, 80 to 85% successful with most people. It's drastic. I mean, one injection. We've had people that had like 90% relief after one injection.
And that's phenomenal.
Yeah, it's amazing. There's not too many other things that will do that.
So this is called Prolozone? Is that what?
That's called Prolozone. Yeah, that's injecting the gas.
Wow.
Yep. And we use that in combination with a couple of other things. This was really discovered by a Dr. Schallenberger in '95. He went over to Europe and learned about it and then kind of brought it back to the States. But we inject that with some homeopathic anti-inflammatories and some other vitamins and minerals along with the ozone. So the combination is very effective.
And then you also use high definition ultrasound, is that right?
Yeah, yep. So for the things that need ultrasound, I have an ultrasound that I can guide the injections. I can, diagnose different injuries, rotator cuff injuries, or, knee, meniscal stuff, hip, end-stage hip, arthritis, ankle stuff.
Let's talk about some specifics.
Sure.
Give us a couple of examples of people and their condition and what's been your results and how long has it lasted?
Yeah. Okay. So in every case is different. It really depends on the chronicity and the extent of the injury. But, for example, a rotator cuff, they come in, they're having shoulder pain. We can scan the shoulder, look for any type of injury there. We can see it very clearly on ultrasound. And, depending upon the extent of the injury or the tear, usually I start off with a series of 3 injections and then kind of see where they are after the third. And they might not be fully healed after 3 treatments, but if they're out of pain and they're functional and able to do what they need to do, then it doesn't really matter as long as they can get back to their lives. So
is there a time between the treatments so that the body regenerates itself?
Yeah, usually like to give it 2 weeks between treatments. Mm-hmm. And initially we can do it even, within a week's time. So I like to try to extend it out a little bit, like you said, but if they're feeling like at the end of the week, they're starting to regress a little bit, which can happen after that first injection, then they can come back in and we can do another one right away.
And so what's the result of the pain? So let's say somebody's in chronic pain, they've had it for a couple of years, mm-hmm. and they come in, they want to get a series of treatments. How does that look, and how does that look at the end? What's been the results that you've had with your clients?
Yeah, so again, depending upon the condition, usually after the series of 3, most people are much better, probably 80-90%. And if they want to keep going, they can. Otherwise, they usually go through life, and if they might do a booster, I'd say every, maybe 4 or 5 months, they might come in and say, hey, I'm starting to feel a little bit in the shoulder or the knee, and we can put a little more in there, and that gets them by for a while. So, again, it really just depends on the case and how serious the injury is and what's going on. But, of course, the younger you are, the better you respond and the faster you respond.
So what is it doing, Alex? Is it actually stimulating stem cell or what's the difference between this and stem cell therapy?
Yeah, so it is. It's turning on stem cells through a number of different processes. Like I had mentioned earlier, when the ozone reacts, it forms those molecules that signal the body to turn on stem cells. So it is turning on, for example, the chondrocytes, which are the precursors to cartilage and connective tissues, the fibroblasts, and all of those stem cells are getting turned on. So it does regenerate over time. It's not overnight, but it does happen. They've done before and after images with a knee, for example, and at the end of a year there was considerable cartilage regeneration after the use of ozone. So,
wow. The reason I ask is because I have a client that is going in for rotator cuff surgery after a car accident he had 2 years ago, and he's gone the medical route. He's gone with the ablation with the nerves and where they've burned the nerves, And he's done that a couple of times. And each time that he's done that, my experience with his, when I palpate, is that he's getting worse. And,
Yeah, right.
and so now he's going in for rotator cuff, and I'm just like, he's looking for a miracle, but I'm concerned.
Yeah. So you were kind of breaking up. What initially was he treating? Low back pain?
Rotator cuff.
Oh, rotator cuff. Yeah. Yeah. So I mean, there could be more going on. A lot of times they're just looking at, of course, one area, and the shoulder is a complex joint. So I really get in there and look at all the entire shoulder, the entire rotator cuff, and the capsule, and the labrum, and all of those things. So
yeah,
there may be more going on, but I would definitely. He's got nothing really. As far as injecting the ozone, there's really no contraindication, and you've got nothing to lose by trying it. Other than you might be out $175 or something. But with regards to doing that before surgery, I would much rather go that route.
Yeah. And what if you've got a chronic that's like 40 years? Is it very effective with something like that?
It is. Yeah, really. It's any and all of those pain conditions it treats effectively.
So I have an obvious question.
Sure.
One is that you mentioned stem cells, and I actually turned them on. So if somebody's thinking about getting actual stem cell therapy, that some ozone therapy in and around that time would probably increase their investment in that, possibly.
Yeah, and they're doing that. There's people that are doing that in conjunction with the stem cell. They're putting in the ozone afterwards.
And what about athletes? I mean, athletes are usually progressive, so they must be already on this.
I think a lot of the athletes now, of course, most people in that area are familiar with PRP, which is platelet-rich plasma.
Right.
That's another regenerative type medicine.
Right.
So a lot of them are doing that. I think there's probably a few that are familiar with the ozone. It's becoming more and more known,
Right.
and especially the people that are going over to Europe to have things done.
Now they can come right here in Sarasota and have it done here.
Yeah, exactly. Yeah.
But one of the most exciting things you mentioned was that the effectiveness in actually as an antioxidant, turning on all of that, and we need that now for boosting immune system and to help to kill off the viruses in the body. We have thousands of viruses at any time already in the body, but people with Lyme's disease and fear of COVID. What about preventative care? Because I'm a preventative care person. I don't take drugs.
Yeah. So I mean, like I said, even with that study that I mentioned earlier,
right?
All the healthcare personnel that did that prophylactically, none of them got sick. Right. So ozone is the strongest antimicrobial on the planet. It's at least 100 times stronger than bleach, and it's antifungal, antibacterial, antiviral. Anti-parasitic. It gets everything. So
this is really exciting, Alex. I'm really excited that you're on this and you're really expanding it. So we're going to be running out of time already. I can't believe it. So what I want to know is how people can reach you. Mm-hmm.
Okay. So my website is long, unfortunately. It's www.sarasotabradentonacupuncture.com.
Mm-hmm.
And my phone number, if they want to reach me, my phone number is 941-444-6336.
And you've got a Facebook page, right?
Yeah, I do. Facebook is under Integral Medicine, INTEGRAL Medicine.
This is great. Great information. I think I've got a couple clients for you, Dr. Smithers. So I'm really excited to know what you're up to. In fact, I think I met you when you were still serving at the Oyster Bar years ago.
Yeah, right. Wow. Yeah, that's going back a little ways.
Yeah, great. I'm so pleased. Thanks so much for joining us today.
Oh yeah, thanks for having me. I appreciate it.
Great to have you. Thank you.
Talk to you.
Thanks for tuning into our show on societybitesradio.com. Don't worry if you've missed a show. You can find them all on our website at SarasotaHolisticChamberofCommerce.com.